Catholic Church has historically been the largest non-governmental provider of health care in the world. Yet, the medical community these days is overwhelmingly secular, steering physical and monetary resources in directions that aren't always in line with Catholic ethics and not necessarily dedicated to curing diseases. We'll talk with a Catholic physician tonight about how to reestablish an approach to healthcare that is consistent with the teachings of Christ. So please stay with us. Thank you and welcome. I'm Father Mitch Pacwa and welcome to EWTN Live, where we bring you guests from all over the world. Before we get to our guest, I want to mention that today is a feast of a number of Jesuit martyrs. The most prominent of them is Saint John de Brito. He went over to India as a missionary, and because he was from Portugal, he was not so much treated seriously, but as he learned Sanskrit and he learned the Hindu scriptures very well, he would use that as a way to launch into his evangelization and move from there to the gospel. And he would also dress like one of the holy men of India. As he began to make many converts, this caused a certain amount of difficulty, and he was beaten once, but continued teaching, and then eventually was martyred and killed. So he is someone that we look to as having that great courage in proclaiming the gospel, but also the ability to understand other cultures and other peoples and make the gospel translated into their language and understanding and bring them towards Christ. Well, tonight we have a guest, as usual, and he has seen firsthand how the advancements in medical research and technologies have instigated a progressive secularization of the healthcare industry, pushing the envelope of medical ethics and pushing out any Catholic influence in healthcare planning and research. He himself is a Catholic physician, a research scientist, and the founder of the John Paul II Medical Research Institute. This is dedicated to a pro-life bioethic and towards finding more efficient and ethical ways to cure chronic diseases by integrating clinical care, medical research, and drug development. So please welcome Dr. Alan Moy. Moy, welcome.
Thank you, Father. It's a pleasure to be here with you.
Thank you. First of all, to let our audience know, where is the John Paul II Institute?
The John Paul II Institute is located in Iowa City, Iowa, and it's we have our research facility also located in our sister city, Coralville, Iowa.
Okay, so and this is doing serious medical research.
Absolutely.
Why did you name it after St. John Paul?
Well, this was, I founded the Institute in 2006, and you have to consider what was the environment at the time from the perspective of Catholics. At the time, there was a false perception among Catholics that the church was against all forms of stem cell research, not just embryonic stem cell research. So there was a public relation problem because of the effects of embryonic stem cell research on the field.
And let's get some of our terms clear here. Yeah, well, first, is the church against all stem cell research?
Absolutely not,
All right.
Father. The Catholic Church is supportive of adult stem cell research. They are against the use of embryonic stem cell research because of the obvious moral implication of destroying life at the very beginning of conception.
See, that's not always so obvious to people, but so when it's an embryo, about how big is an embryo?
Well, an embryo is really the size of a dot, of a pencil. Okay. It's very, very small. It's microscopic. Okay. And so all stem cells are fairly insignificant because they're basically found in every form of tissue, whether it's an embryo, a fetus, or an adult. They're essentially representative of about 1%, 2% of all the cells in that tissue. And so you have to purify, procure, and then grow them up to sufficient level for them to be of any use.
Okay. So the stem cells are present at all stages of life.
Absolutely.
And why were people going to embryos? Because, I mean, one of the problems is not only does the embryo die, but you can't ask the embryo if you want to be killed for your stem cells.
Absolutely.
So why were people going to the embryos for stem cells? So
just a little bit of background about, what is an adult stem cell and how it is different from the embryo and why the secular scientists were attracted to the use of an embryonic stem cell. So a stem cell has two basic features. It has the capacity to grow to a large level, number of cells. It also has the ability to differentiate or convert into some type of specialized cell. Now, an adult stem cell is defined as anything that was derived from the moment of birth onward. And an embryonic stem cell is obviously developed from an early embryo. The embryonic stem cells have this enormous capacity to become anything, all the 200 tissues of the body, and that's what attracted the secular scientists, because it could become, potentially any type of specialized tissue. And that's what drove the interest among the secularists.
So this is something that was very, it sounded very plausible, something that could really help a lot of medical problems. If it can grow into anything, then this would be what they would do. And how did they procure the embryos? If the embryos are just the size of a dot from a pen or a pencil, did they go into women's wombs to get fertilized embryos and bring them out?
So what they did was it evolved from the in vitro fertilization clinics. So some of these embryos, which were supposed to be destined for fertilization, there was often an excess number of fertilized embryos that were not implanted. So what they term as spare embryos. And so they used these spare embryos to essentially let them grow to a specific age, typically about a week. And then microscopically, they would go in and procure a number of cells from that young embryo. And in the process of doing that, obviously, you have to destroy the embryo to procure those cells.
Right. So they would go to the in vitro fertilization clinics, and because they always fertilize a number of extra ova, they take a number of ova from a woman, fertilize them, and put them in until one of them finally takes. If they have leftovers, and that's what they talk about, is leftovers, right, then they offer it up for the stem cell research.
That's correct.
All right. So that's how they don't open up a woman to get it from her womb, but they just produced it in the lab.
And in the United States, it's very common practice for the IVF clinicians
in vitro fertilization ones,
to basically make up a number of fertilized eggs and keep them in storage in the event that a pregnancy does not occur, so they can always go back to their storage facility in the freezer and pull one out.
I remember a case in one state, I think it might have been Tennessee, where a couple had, gotten these embryos through artificially in vitro fertilization, and then the couple died in a car wreck, and the family was talking about the inheritance of the fertilized ova, that these embryos would inherit their property. And this became a source of a court battle. So this is the kind of thing that goes on. Now, what were the results of using the stem cells from embryos? How did that work out medically? Ethically, we have problems because you have to kill it. But how did it work out scientifically and medically?
Well, the bottom line is the jury's still not out. The embryonic stem cells are currently being used in a variety of different applications. One as a therapy or attempt in developing a therapy, and the other is actually to use it as a tool for creating drugs. So in the area of trying to develop therapies, there are still ongoing efforts by various academic centers or by biopharmaceutical companies to try to use the embryonic stem cell for treating a variety of different clinical diseases. So in that arena, it's too early to say, but there has been no approval by the FDA to use a embryonic stem cell for a particular treatment at this time. But the embryonic stem cells are being used by the pharmaceutical industry because they're trying to test for drug safety. And so in that situation, they are used for evaluating drugs for their efficacy or for their safety. And it may not have anything to do with using the cell as a treatment, but as a byproduct to find new drugs that may have nothing to do with embryonic stem or as a cell therapy.
So would it be that in some way, maybe it's a rough analogy, that they use the embryonic stem cells sort of like a lab rat?
As a human subject, basically a microscopic human subject as a lab rat to basically to test for the potential benefit of a drug that might be an investigational drug that might be out there.
Yeah. Now, you don't use embryonic stem cells.
No, the Institute declares that it does not use embryonic stem cells. It is a pro-life organization that uses only adult stem cells.
Okay. So you can get stem cells from adults. Presumably, the adults are able to give you permission to get their stem cells.
That's correct.
Does it kill the adult to get their stem cells? Do they die from this?
No, they basically are providing a sample of their tissue essentially in a non-harmful way or a non-destructive way to procure those cells.
So nobody dies?
Nobody dies.
Okay. All right, that's unlike the embryo. All right. This is a Chicago kind of question.
Sure.
We always are looking for that kind of thing. Now, in terms then of the adults, how does the use of adult stem cells compare to embryonic stem cells in your research?
Well,
not just yours, but I mean
in general,
in scientific research.
Right. In general, there's always pros and cons of adult stem cells versus embryonic stem cells. So adult stem cells, they have already been programmed to do certain things because they're older.
Right.
And but their downside is that a lot of these stem cells don't have the diversity of becoming a lot of different things that they would otherwise be doing in the mother's womb. So that's one that's the one disadvantage. But for certain clinical diseases, that might be a good thing. So for example, a bone marrow transplant is actually a form of an adult stem cell. It's a crude form where you're taking bone marrow from a donor, which has stem cells in it, to essentially repopulate the bone marrow of that recipient who's been receiving chemotherapy. That's the most classic form of an adult stem cell treatment. And
to get that bone marrow, they have to go into somebody's living bone.
Into someone's bone marrow.
Yeah, bone marrow. Yeah,
yes.
But they have to go into the bone to get into the marrow.
Exactly.
And that's to be a living person, and then they put that into inside the bone, into the bone marrow of another living person.
Exactly.
Sounds painful.
Well, it actually is done under anesthesia, so most people don't experience that going right in when the doctor goes in with the needle.
Good. So this is, you say that this might actually be an advantage, that the adult stem cells are not as capable of such diffuse possibilities. But why would that be advantageous?
Well, there's some safety issues. If the embryonic stem cell is very unstable, it's genetically, it's programmed to become very diverse. And if you put an embryonic stem cell in, say, a lab rat, a mouse, it will have uncontrolled growth and form a tumor. So from a safety standpoint, there are some advantages of using an adult stem cell because to date, there has been no significant evidence that the adult stem cells, when given to a donor, will produce a tumor.
Okay.
So that's a definite big advantage.
Whereas an embryonic stem cell can cause a tumor.
Potentially could cause a tumor. The other, notwithstanding the ethics issue, an adult stem cell may have some potential advantages in terms of the cost of manufacturing that cell therapy.
How so?
Well, one is that it's easier to procure. It's for an embryonic stem cell, it's often difficult to procure spare embryos. It takes a while to grow a cell line up. It can take sometimes up to 6 months. And so that's the difference between 6 months and perhaps 1 to 2 months for developing an adult stem cell.
Okay, all right.
So there's a big difference in terms of the cost of production.
And the speed of production.
In terms of getting a cell therapy,
right.
there's some significant advantages. Now, the downside with adult stem cell is that it cannot produce certain types of cells like an embryonic stem cell, with the exception of a new type of adult stem cell, which is artificially created. And it was introduced in 2007 by a Japanese scientist, Dr. Yamanaka. And he produced what's called the Ips cell. And the Ips cell was developed, which has embryonic-like stem cell characteristics. And what an Ips cell is essentially not using an embryo, but taking an adult cell and genetically reprogramming it back to the most earliest stages of human life into an embryonic-like stem cell, so that it can produce all of the same types of cells as an embryonic stem cell, but without the ethical controversies surrounding it.
See, and this is something that's very important, because, one of the temptations of any period, it's a human temptation from any period of time, including our own, is that, look, let's just get it done. If we're going to cure something, who cares how we got it? Let's just go ahead and get it, because the end will justify the means of getting it. Now, you don't hold to that ethical position in your research.
No, I think, I think if you look at medical history, where ethics are interplaying with life science. There's always two paths. There's the easy, and then there's the hard way. And in the easy way, it often leads to some ethical controversy and results in regret. And often the science sort of stagnates at that point. The hard way is scientifically hard, and it involves sacrifice. And in the end, if you follow the hard way, often there are unforeseen benefits in terms of humanity when you pursue that. And also, I think the science advance is far more greater than you would have otherwise expected if you chose the easy way.
Right, right. You know, at the far end of the evil would be the kind of pseudoscientific experimentation by doctors in the Nazi concentration camps. That would be the far end of, you know, evil. But that's really the extreme. Most of the time it'd be, you know, somewhere, you know, at a different state of the spectrum of morals where, well, we'll fudge a little bit, but the best is to have moral integrity. And that allows you to keep doing the experiments because you have that moral integrity that doesn't cause these second thoughts.
Yeah, the thing that I've noticed about when I listen to the secularists talk about their rationalization is that their rationalization is not well schooled in terms of, you know, good rigorous bioethics. I mean, there are laws that are guiding human subject research that if you actually look at the content of those laws, they actually fall within the realm of Catholic teaching. So in 1974, there's a law called the National Research Act that has defined there are certain requirements that a person who is subjected to any type of medical research, there are certain criteria and guidelines that have to be obeyed. One of which is the issue of everyone has autonomy, the autonomy to informed consent. Yes. The other is beneficence, that no harm should be done. And the other is there has to be some justice involved. So that was an individual can't bear the burden of medical research at the expense of the community or society. And the last is that those who are the most vulnerable historically, the mentally challenged, children, they have to have special protection. So when you consider that background, what is already deemed laws in the United States in terms of, and around the world, in terms of conducting human subject research and apply that to the human embryo, there's a lot of similarity and overlap between that. And I think what it comes down to is, do we consider the human embryo as an individual?
Yeah. That certainly is a big issue. And again, can we go ahead and just destroy it when, in fact, we can harvest stem cells from consenting adults? And you know, this is a big difference morally on adults who don't die in the process. Now, when it comes to doing the research at your institute, would have been some of the areas where you're finding some success, where do you see some failure? What kind of progress have you seen yourself make at the John Paul Institute?
So we focus on 4 areas. We focus on neurodegenerative diseases. We focus
Such as, what would be some examples?
Alzheimer's,
okay.
Parkinson's disease,
okay.
ALS, and there are
ALS is
amyotrophic lateral sclerosis, or Lou Gehrig's disease.
Okay,
this is a chronic motor neuron disorder where patients ultimately develop progressive paralysis.
Right, right. Very painful disease, I'm told.
It's a very scary disease when someone has to be ultimately paralyzed and unable to have any control over their movement or their motor function.
And a number of these type of diseases have people that are well known getting them. You know, certainly J. Michael Fox, and Muhammad Ali, President Reagan, a number of people. John Paul himself had Parkinson's disease. So that's one area of your research.
That's correct.
All right.
The other area is in cancer. There's one of the areas, as I mentioned, stem cells are considered good, but stem cells also can be bad. Adult stem cells can be bad. A lot of cancers are actually created because they're created from a stem cell that became cancerous. And that cancerous stem cell gives rise to all the cells in the tumor. And the cancer stem cell is actually more resistant to radiation chemotherapy. It's the reason why a cancer may metastasize or may relapse. So our institute is very interested in developing techniques to able to take a patient's tumor and grow it out and keep it alive so that we can have a better information, better tools to figure out what's the most personalized treatment for treating that patient's cancer.
So some of these cancers are not just a general type, but are in some ways oriented towards that individual because stem cells have grown too fast in an incorrect kind of way that's destroying the organism.
So the cancer stem cell has gone rogue, if you want to say. They have become they no longer regulated by the normal processes, and it becomes uncontrolled and creates these cancer cells that become more potentially more difficult to eradicate them.
Yeah.
And so the other thing the other area we focus on is rare diseases. These are diseases that defined as patients who there are less than 200,000 patients who are afflicted with disease, and we chose that because typically there are less than 3% of those diseases, there are over 7,000 of these rare diseases. ALS is actually one of them, where there's no cure or treatment for those types of patients. So there was a lot of lack of support for those patients, and a lot of patients and doctors have been complaining that they wanted to see more support.
Well, one of the reasons some diseases get more research than others is well-known people in the public arena have them, so there's interest, but also if there are a lot of customers for a medicine, pharmaceutical companies will devote more energy to that. Would that be correct?
Absolutely. It's a market business.
Yeah.
And it is, if you have a disease where there are several million as opposed to maybe 500, the economics drives it to where the bigger market is.
And that's not saying that, well, the pharmaceutical companies are just evil, money-grubbing types. You know, they're also going for what can we cure more people of. You know, and that's sometimes the motivation as well. I mean, they can finance it, but they also want to get the most cure for their research.
Absolutely.
So it's not mean and evil, but it is a fact of life.
They are businessmen, and they're looking to make a profit.
Yeah. So it's this is something that, as a matter of fact, if they don't make a profit, they can't do research.
Right.
Yeah. So you do not-for-profit research.
That's correct.
And that's why you'll take on these diseases that are not so well known.
That's right. So they're really, so how the Institute really differentiates itself is obviously we're pro-life, but if we were just pro-life, that would not be enough.
Right.
So we have to do, since we're an early stage organization and we're really competing against well-established organizations that are supporting embryonic stem cell research, which it's very difficult to find an established private foundation that now doesn't support embryonic stem cell research. Sure. We have to find ways in which to differentiate ourselves from those organizations. So the other two ways is number one, we try to direct most of our research budget towards research. So typically a lot of organizations will spend between 15 to 25% of their expenditures on research and development. Mm-hmm. You know, we try to increase that by 2 to 3-fold, because if we want it, it doesn't make any sense to actually, if you're going to find cures or treatments, you have to spend the most of your money towards R&D.
Right. Research and development.
Right. The next issue is there really hasn't been a lot of innovation in two areas. One is how to change the cost of taking care of a patient. So 75% of the healthcare costs are devoted towards chronic diseases, diabetes, heart disease, lung disease, and all of these are due to chronic degeneration of human organs. Right. And so what we're trying to do is try to develop cell therapies. Our objective will be to try to develop cell therapies. And so the FDA has some stringent criteria on how to do that. So we're trying to raise money so we can take the adult stem cells that we have developed and get them into the clinical trials. And it requires a certain amount of infrastructure to satisfy the FDA.
Sure. So not to do that. Now, we need to take a little bit of a break. We want to come back, make sure we get your questions and your comments. If you are interested in knowing more about the John Paul II Medical Research Institute, you can go to their website, which is jp2mri.org, jp2mri.org. Or you can call their number, which is 319-688-7367. We'll be back in just about 2 minutes and get questions from our studio audience as well as from you, so please stay with us. Thank you. Welcome back. First of all, I'd like to invite you to come and join us, be part of our studio audience. If you can make a pilgrimage down here, we'd love to have you. Please contact our pilgrimage department at 205-271-2966, or you can go to the website EWTN.com. and they will give you information about schedules of masses, programs, places to stay. You have a number of good places to eat. I know you live up in Iowa, but we have some great fried green tomatoes over at the Irondale Cafe, and good barbecue, religiously themed restaurants, a barbecue place called Golden Rule. See, that's good. Hamburger Heaven. Yeah. So I'd love to have you come and join us and be part of our studio audience as well. You ready for some questions?
Sure.
Let's start off. Hello, Marianne.
Hi, Father Mitch. First of all, thank you for your wonderful presence.
Thank you.
Really love your show.
Thank you.
And I want to, I'm calling from Connecticut, but I used to live in Iowa City, and I went through the nursing school there at the University of Iowa, and I'm just curious from Dr. Moy, what might the impact be on the large university hospital and medical school that's there, the influence of this new foundation, new institute? Because I remember Iowa City as a very liberal, left-leaning place, and very on the side of, sort of on the blue side of issues of red and blue. And I'm just wondering if there's interest among the medical faculty or other people and clinicians there at the University of Iowa, which is such a very, very large and actually quite important medical school and hospital. And P.S., my son is the principal of the high school there, so I'm interested in what you have going on.
All right, thank you, Marianne. So you were associated with the University of Iowa.
I was associated with the University of Iowa. I think the question is really to uncover how does the secular community, the scientific community, the medical community view the institutes based on our mission statement, our position on the pro-life side. I think that my personal experience is that that most of the staff and the faculty that I engage with are supportive. They're more interested in the bottom line of science.
Right. What are the results of your experiments?
Right. They're interested in the outcome in the science. So most people, I think, are driven, whether they're pro-life or they come from a secular philosophy, are still interested in patient care and finding cures.
Yes, yes. So if you are discovering elements of research in a cure, they have no problem with it, right?
No, and in our model, we can't do everything by ourselves. We have to sometimes collaborate with secular institutions, and we have applied that in a collaborative way, both with academia and government, to try to push drugs into clinical trial.
Okay, so there's in general, we're not going to do it your way, but
right.
You're doing good research, you're a good scientist, we like it.
Yeah, and I would add that the Institute has certain advantages that government and academia doesn't have.
Mm-hmm. In what way?
Well, one of the things that we're able to do is that we don't have the red tape and the bureaucracy of academia or government in particular.
Yes.
So what the Institute is really best at doing is to take a patient with a disease and develop a stem cell of that patient's disease to use as a surrogate, as we were talking earlier.
Sure.
Of using that stem cell as a surrogate, as a human subject or a guinea pig to find a treatment. So we were actually the first one to actually come up with an adult stem cell for a rare disease. Mm-hmm. We were the first ones to provide that stem cell to NIH to help
NIH, which is?
National Institute of Health.
Okay.
It's the government's major federal organization for sponsoring medical research.
Okay.
So we provided a stem cell from a couple siblings with a fatal condition called Niemann-Pick type C. And these are children who have basically will have inability to metabolize cholesterol. So it builds up into their cells, and their nerve cells are particularly vulnerable to being injured and die. So these children is actually the most common cause of juvenile dementia, and in its later form can cause ALS-like condition. So these cells were developed. So we had children from Oregon come to the Institute, and we harvested some of their adult stem cells, developed a model to allow scientists from academia and NIH to test drugs for that. And they found a drug that could cure the cholesterol defect in that cell. And then the children went on independently to receive that same drug, and it significantly helped benefited them. And so now, along with the work of other scientists, both in government and academia, a pharmaceutical company has taken on that drug and put it into a clinical trial to treat those patients.
Great. That's a great thing. I have a question from our studio audience. Father, where are you from?
Dr. Moy and Father Mitch, my name is Father Jeff Allen. I'm a priest of the Archdiocese of Detroit. I just have a question in regards to what's called snowflake babies. And in recent years, there's been development for what's called snowflake babies, in which in vitro fertilization has produced embryos in the lab, and these embryos have been, in other words, leftover embryos, and so they've become frozen. And so my question is, what are your thoughts on allowing these babies as frozen embryos to remain frozen, or whether or not you think it'd be a good idea to take these frozen embryos and put them in the wombs of mothers as surrogates and allow these children to grow and be born? So.
That's a great question. Yeah. It's a ethically difficult question.
It is.
I think those embryos, at the very least, need to be maintained alive, and they have to be viable. So I think that those embryos either have to have the opportunity to live and grow and develop, or they at least maintain and kept frozen. Some of these fertilized embryos, parents have to pay the cost to maintain them in the freezer. And so I think it's important to, and it is costly to keep them frozen. So I think that either the parents need to try to keep them, pay the cost of those embryos and keep them alive in the freezer, or at least society should try to keep them alive, maintain the cost of keeping them alive in the freezer.
But to what end? See, that's, I think, part of Father's question too. To what end do you keep them alive in the freezer? Is there not some point at which either you have to destroy them, or you put them in a womb? I mean, they're oriented. Any embryo is oriented towards growing inside a mother's womb. That's its whole purpose. And at some point, you have to make that. Somebody has to make that decision to destroy it, or to give it a chance to live.
Well, I would probably obviously opted to give it a chance to live, and if it meant giving it to a surrogate, I don't know how that would be any different from someone adopting a child. Yes,
exactly. And that's what they're talking about. And this is one of the problems. This is a very complex kind of thing, and we don't know how the church is still trying to grapple with this, because it's not right, but is it right to destroy them? Again, these are the options. So it's a very complex issue. Let's now go over to Rocco in Florida. Hello, Rocco.
Hello, Father Mitch.
Hi. What's your question?
Well, sir, we've been talking about adult stem cells and embryonic stem cells. It's my understanding that it's become fairly popular, especially for people who can afford it, after their child is born, to have the placenta frozen. And I understand there are stem cells in that, and that's the idea of freezing these placentas. Where does Holy Mother of the Church stand on using the stem cells from this placenta?
Well, the placenta is really an adult, that by definition is really categorized as a source of adult stem cells.
Right.
So there are a variety of different stem cells laying within the placenta. So there is no ethical issues associated with using the placenta or the cord blood or the umbilical cord.
Okay.
The question is, should you freeze them? Is there any value to freezing the placenta for later use? My experience with using the placenta is that if you try to freeze any tissue, cord blood or the placenta, the chances of it become very viable in terms of harvesting stem cells significantly drops. Okay. So if you're going to use stem cells from those sources, procure them when they're fresh, not when they're frozen.
Right, right. So you do that right away. But yeah, there would be no destruction of life in that case. It would be something that a person could do without any difficulty. We have Linda on the line. Hello, Linda.
Hello, gentlemen. I was blessed some years ago, half dozen, to have hear a talk at my parish from two lay people, a science teacher, high school, and a pro-life lawyer. And they were wonderful. And I learned that time, I believe it was 54 diseases that were either ameliorated or cured with adult stem cells versus 0 for embryonic, and I'm wondering what the new number is, and would you repeat it intermittently? I think it would do your listeners a great deal of good. They could disseminate the information. That is my question. What's the new number?
Linda. I appreciate that. So what do you know a number of the diseases that are ameliorated or cured by adult stem cells?
Some people have used, numbers like 200 or hundreds of diseases that could be cured or treated with adult stem cells. I would caution the audience about being fixated on the number because, there's a lot of these stem cells are being used in adult stem cells. Let's talk about adult stem cells are being used in clinical trials and have failed to show evidence of success. Okay.
So they don't always work.
They don't always work, and we don't know. Some patients, they may work in some, and they won't work in others. Mm-hmm. And some adult stem cells work in different ways. The way they work, their mechanism of action is very, very different than, say, an iPS cell, which I mentioned earlier, or an embryonic stem cell. So I think the issue that we have been trying to deal with scientifically at the Institute is trying to create a iPS cell that could replace the embryonic stem cell and make it obsolete. So the embryonic stem cell has, three major disadvantages. One, it's expensive to produce. Second is that you have to take, it's a foreign tissue if you're going to transplant, like any type of organ transplant, it's foreign, so you have to take anti-rejection drugs. There's risk to taking anti-rejection drugs because it lowers your immune system. And lastly is the issue of tumors. So we've been working on an iPS cell that I mentioned.
Tell us again what iPS stands for.
What it stands for?
Yes.
The iPS cell, it stands for an induced pluripotent stem cell.
Okay.
This is a stem cell where you take an adult cell and then genetically reprogram it back into the very early primitive embryonic-like stem cell. So what we have done is taken a iPS cell that has lower cost to manufacture, reduces or eliminates the need for using anti-rejection drugs, and has a much lower risk of tumor formation. Yeah. So the way to combat this moral issue debate between the embryonic and the adult stem cell side is through innovation in science, not to get into a battle of words, a war with words between the two groups, but try to find a solution that will satisfy patients who have MS or have other diseases that if an adult stem cell doesn't help, perhaps an iPS cell would be a good alternative.
Sure. So, in other words, you don't want lawyers just using numbers. You want doctors doing research.
Right. I think that there are some diseases that an adult stem cell, when I say adult stem cell, I'm talking about the legacy, the cord blood, the bone marrow.
Sure.
Those stem cells will not likely help patients who are blind or help a patient who has a spinal cord injury. So you're talking about patients who are going to be feel very vulnerable, choosing between accepting a treatment that may be unethical and conflicts with their moral position,
sure,
versus having a treatment that could potentially treat their life-threatening disease, their
sure,
illness. So what we try to do is let's create a cell that can be distributed to scientists who want these pluripotent stem cells without having to worry about the moral, ethical controversies associated with them.
Okay. We have another caller. Hello, Ruth? Ruth, are you there?
I am.
Oh, there you are. Where are you from, Ruth?
I'm from Broken Bow, Nebraska.
Great. Good to have you on. We have a lady in our audience from Nebraska here. So what is your question?
I was wondering, when a person gets those stem cells, I was wondering how long they last. I know a person that had a stem cell, and because of cancer, how long does it last?
All right, so, and by last, I think, how long is it going to be effective might be part of the issue. What's going on there with that?
Well, that's a great question. That is actually one of the challenges in stem cell therapy, is that if you take a cell and you put it into the body, the question is whether it will even survive.
Uh-huh.
And
would that be because the body might attack it?
Well, no, it's because the cells have been grown artificially in a condition that may be very different than in what's the condition in the body.
Sure.
And so now you take a cell that was artificially conditioned and then shock it into a different situation, it may not survive. Yeah. So the issue is cell survival.
Yeah. Okay.
The other issue is if you inject a stem cell into your bloodstream, and you are trying to target a specific organ, let's say you want to target the kidney or the heart, a very small fraction of those cells actually get to the targeted disease. Mm-hmm. And so these are actually challenges that the stem cell community are trying to grapple with.
Yeah, yeah. Now, so this is very important. Now, one of the things just also want to ask, do you find that there are defects that might be found in some of the frozen embryos, either because of the artificial, the in vitro fertilization process, or because of being frozen for so long? Do you see problems and defects in those embryonic cells?
So the embryonic stem cells, when you grow them out and grow them in culture and keep them in cell cultures long enough, they can undergo genetic changes. Uh-huh. So there's always concerns what those changes that are going to occur over time. So there's always a potential with embryonic stem cells. But you can also see those with adult cells. So you have to be very careful about following through and knowing how these genetic changes are occurring over time.
And I think a number of the things you're saying are very important because on one hand, we've had a public perception from the media in particular that, this is going to cure all of our problems. All the diseases are going to go. And the adult stem cells are going to cure everything. Where we have to pay close attention is in good science that is very carefully studying what's going on in fact, and not with, hype kind of hopes.
That's true, Father. There's often when there is a new field of research, there's often a lot of enthusiasm and hype. Yeah. And after a while, the dust has to settle. And
the real work get done. Well, I want to just let people know again, is the John Paul II Medical Research Institute. Their website is JP2, the number 2, JP2MRI.org. Phone number is 319-688-7367. They're going to keep doing a lot more research and doing it in this ethical way. I want to thank you for being with us, and I want to give you all a blessing. Almighty God bless you and keep you, the Father, the Son, and the Holy Spirit. Amen. We can bring important discussions of difficult subjects like this because you make it possible for us to invite such guests. So please remember to keep us in between your gas bill, your electric bill, and your cable bill. And we'll be able to pay our bills too. Thank you.